Hi, this is Dr. Serena Satcher from Treat Yourself to Health. And today I'm going to talk about the 3 top reasons why you can't lose weight. And this is a very short video. Um, Dr. Sanza at 3D Wellness and I from Treat Yourself to Health have a joint weight liberation program called BU to the Fullness. And some of the most overlooked issues that we see amongst people that join us in this program are that number one, they may be over exercising, or their perspective of exercise is out of order or out of range in perspective with what they're trying to accomplish with their bodies. An example that I'll give is a menopausal woman who has a lot of systemic inflammation for different reasons that she may not know. And then she's over exercising, which may look like a normal amount of exercise, but when you have systemic inflammation and you have inflammation markers showing up in your blood work, that means that we need to get the inflammation under control, because what's going to happen is your body is going to make fat in response to that inflammation. And so if you're over exercising or exercising too much when you have a lot of inflammation, that can cause you to make more fat. Sounds crazy, but this is one of the top things that I see when people come to us trying to lose weight and they've not been successful. A second item that I'll mention that's very common is that there is some issue with sleep. Either the person is not allocating enough time for sleep and rest and winding down so they can sleep, or there may be complex hormonal, digestive, and other issues with the immune system that are making it so that the person cannot sleep properly. Most adults are going to require at least 6.5 hours of sleep, between 6.5 hours and 10 hours of sleep. And so if that sleep is interrupted, if you're having to get up in the middle of the night to go to the restroom, or you're waking up in the middle of the night and you can't immediately go back to sleep, or you're having trouble falling asleep, or you're having trouble maintaining sleep, or you're waking up in the morning and you don't feel refreshed, there are a number of issues that could be attacking your sleep, and that needs to be addressed, because we know from many studies that if you're not sleeping adequately, you will not be able to burn fat. And the fat is what you're trying to lose or get rid of or get under control when you're trying to lose weight. You're not trying to lose muscle mass. Also, if this goes on for a long time, you will start to lose muscle mass. That's the last thing that you want to do when you are middle-aged, is lose muscle mass. So that's number two. So number three, many of us are consuming more alcohol than is recommended. And recent studies have shown that as few as 3 drinks a week for a woman can cause a process with the hormones that will cause them to put on fat and to lose muscle, because the alcohol is interfering with enzymes that help the body to make muscle. So, and alcohol interferes with the sleep cycle. And we know this because there are recent studies showing that alcohol interferes with the generation of brain waves that affect restful sleep. So these are the top 3 things that I am seeing recently in terms of what people are missing. And generally in conventional medicine, there is not a focus on these areas. So these are not the only things, but these are some of the top 3 that I am seeing that people are missing when they are trying to lose fat and to get their body composition in a better place to be healthier and to get off medications. Those are the ultimate goals that we want people to focus on, is to be healthier and to get off medications if at all possible. Thank you for joining me. You can reach me at treatyourselftohealth.com. If you go to treatyourselftohealth.com www.enlightening.com/schedule. You can schedule an appointment. I would recommend you schedule a discovery visit for 30 minutes so that we can get you to fill out a questionnaire and I can understand what health issues you're concerned about and also what your goals are. And then you can send me messages on Instagram and Facebook. And I'm also on LinkedIn. And if you're on LinkedIn, you can message me there. On LinkedIn, I am listed as Dr. Serena Satcher. And, if you have an account such that you can send me messages, I will try to answer your questions on the messages. However, I will also tell you if you ask a question that's too in-depth, I will ask you to schedule an appointment. All right, so I hope that this was helpful today, and I look forward to talking to you in the future. Thank you.